السلام عليكم. أنا سارة ريتشارد حسن. يسرنا حضوركم الكريم لتدشين صندوق طوارئ السودان سيرف. نرحب بالحضور الكريم وبالنيابة عن الزملاء. قبل ما نبدأ عندنا شوية هاوس كيبينج. عندنا مرطبات آخر القاعة و emergency exit آخر القاعة على إيدكم الشمال. وعندنا باركود للتبرعات at least 5 pounds، لكن إذا حابين تدفعوا زيادة ما في مشكلة. عندنا our guest speaker is Dame Rosalind Marsden. وعندنا كوكبة من المتحدثين، زميلنا ممثل الصندوق. بعد ذاك حتكون في كلمة من Empower Women for Change, Sudan Women for Peace, Sudan Platform for Agriculture and Food Security, Proximity to Humanity. بعض المتحدثين حيكونوا عن طريق الزوم، فياريت تشاركونا بإرسال الروابط وتفعيل الهاشتاج سيرف فور سودان. حنبتدي أول حاجة بفيديو قصير وبعد ذاك حنبتدي التدشين. اتفضل يا تفضل. Okay, good afternoon, everybody. We're delighted to welcome you to the launch of Sudan Emergency Response Fund. We have a group of guest speakers today, and our guest of honor is Dame Rosalind Marsden. We have a group of speakers, my colleague Nabil Arman, who will start the launch, followed by speakers from Empower Women for Change, Sudan Women for Peace, Sudan Platform for Agriculture and Food Security, Proximity to Humanity. Some of the speakers will be talking through Zoom, so we will appreciate if you share the links. My colleague, Dr. Nabil Arman, he's the Vice President of Sudan Doctors Union, UK branch. If Nabil, if you'd like to start.
So the outlines of my presentation is about the project an introduction, a little bit of background about Sudan Doctor Union and their effort during war, and also some background about Sudan Civil Humanitarian Emergency Room, and then why Sudan Emergency Response Fund, an overview and some information about how we're going to run the work. So I'm going to start about the outlines. As I said, introduction, background about our work and Sudan Civil and Humanitarian Emergency Room, and the collaborative work which we are going to launch today. Okay. Everybody knows about the current situation as described the worst humanitarian crisis in recent memory by United Nations Office for Humanitarian Coordination of Humanitarian Affairs in Sudan. And everyone probably update about the numbers and the worsening crisis every day. %60% of hospitals in conflict zones are out of service, and the warring parties target local aid volunteers, detaining them and killing them. So about the background of Sudan Doctor Union, initially it was first started in the mid of 70s, but the formal General Assembly was in 1985. Since then, we have been doing our elective committee election every 2 years. And then I'll talk about the health projects during the last few last few years before the war. After the revolution, we managed to do some projects in different areas in Sudan. Jireba Hospital, Kabkabiya Hospital, Al-Gadarif. That was in cooperation or collaboration with my sister fundraising committee, and also some work in Nial Hospital. All of those were big projects, and in collaboration with some fundraising groups. And the last project was was December Revolution Center for Rehabilitation and Traumatic Spinal and Brain Injuries. Was the first center established in Sudan for rehabilitation. And that was just before the war, was in collaboration with Ministry of Health and Khartoum Teaching Hospital. So as we know, the war erupted on 15th of April, and they start some of the, or RSF, they using the hospital as military base, and also the bombing and shelling hospitals. The health professional staff were attacked in different areas. So that was big turn from big projects to small projects in order to maintain run the crisis. Yeah. So early at the beginning, we do have a forum from different doctors' association and unions in different countries, including Sudan Preliminary Committee, Sudan Doctor Union in Sudan. That was from collaborative work from Qatar, Ireland, SAPA, Canada, and Australia and New Zealand. So we have sent like joint statement. The first one was as second day after the war to the Security Council, and then during the period of war, we keep sending statements to different organizations, humanitarian organizations, just to explain the situation and get more support. And going on, we managed to do like collaborative work with the Sudanese community in the UK in different areas across different cities by doing fundraising in different areas, fundraising event collect donations. That was in Birmingham, Oxford, Manchester, Stoke-on-Trent, different, it's not exhaustive list. And also we managed to spread the message across the media, and we've done like a press conference in Social University. And then we focus mostly in the health projects. We try to supply different areas because the crisis was massive in different areas. So we start by doing clinics, mobile clinics in the Argin and Ashkate in the borders. And then Wadi Halfa, there are also some collaborative work with our colleagues in Ireland to support Lubayt Hospital and Umbukol in Adbara for displaced people. This also was some different projects in Durman, Salha. We've done some work in Al Jazeera Center for Psychiatry with our colleagues in the, as I explained earlier, the forum from different unions and bodies, Sudanese doctors. We support Hadirin organization to make alternative residential home for elderly, transfer from Khartoum to Shendi, and we have sent some internal fixator for injuries and orthopedics. We managed to send some support for this displaced people from Al Jinena to Edri. This was mobile clinics in Edri in Chad. And also in Nial Hospital, and as you know, as the war evolved, there was some outbreak of different problems due to lack of public health. There was some outbreak, malaria, dengue fever, and so we managed to support some emergency response committees with supplies, fluids, in Bahri and Umdurman, in different areas. Later, there was an urgent need for even clean water and food as all progressed. So there's some background about Sudan Civil and Humanitarian Emergency Room. We have met, we came across people from different organizations do similar things. So emergency response room, they do the same projects in different areas with different scopes. They established after the war, and they were inspired by the local emergency rooms in Sudan, and they do have good connection with the emergency rooms, the other emergency rooms in Sudan. They contact them, and they supply food and nutritional supplies. And they support different areas, Takaya and Wad Madani in emergency response room in Al-Hizam, Kadugli, Al-Diwem, Gosgrafi, and Al-Zafir, Takaya Al-Zafir in Durman. And they do have also good connection on the ground with the emergency response room and Takaya. They keep working in different areas also. They support in Al Jinena, Al Thawra, 12, and Azraq Taiba Society, Sacramento Society, and Kubaya organization. So when we reached to that point, we thought, why we don't do like a collaborative work? So the trigger, the idea came from Sudan, from emergency response room, the humanitarian and civil emergency response room in London. And we thought to work together collaboratively and try to do a single platform. As we know, there are different organizations working in the similar issue with different groups on the ground. That's the idea for launching a single humanitarian platform, trying to avoid duplicate of work, and it's not working again. Try to avoid the duplicate of work and try to bring all the resources together in order to distribute it to the priorities. So here we go. Why Sudan Emergency Response Fund? The vision, as I explained, is that the project aims to create a single humanitarian platform for British Sudanese organizations to support people in Sudan. It's going to be strict adherence to humanitarian principles and refraining from taking any political side, and ensuring transparency, accountability, and effective distribution of resources to the most need inside. The main goals is about create a database of resources, including materials, experts, and funding opportunities available to assist with humanitarian efforts inside and outside. By outside, I mean the Sudanese refugees in different countries around in Uganda, Egypt, Chad, or Ethiopia. Organize collective fundraising events across different regions in the UK to maximize the contribution for support and raise awareness. To communicate with local and international charity bodies to facilitate more funding to support the crisis in Sudan. Develop a centralized information hub to educate public about the crisis and mobilize resources. Engage and collaborate with British Organization for Peace and Human Rights to advocate for policies supporting humanitarian efforts. And finally, promote diversity and peaceful habitation amongst Sudanese community. The main idea, we're going to rely on the grassroots, on our connections on the ground, which is the emergency response rooms, the Kaya, communal kitchen, and also our colleagues in Sudan Preliminary Committee of Doctors Union, just to try to find where to start, because it's the key here is the priority is important, and the key is the priority. Try to get where to target first. As we all know, the need is massive, is beyond our capacity and everyone's capacity, every organization. That's why it's better to do work or collaborative work and prioritization. The way we're going to work is just brief in standard operation procedure. The definition is collective, collaborative framework. This is just a line of framework about standard operation procedure. Members, any organization that participated and signed the project plan form. The coordinators, their main task is to oversee platform functioning and maintaining communication and facilitate the decision-making process. So it's going to be a collaborative work with the coordination rather than doing the SDU leading on its own. So, or emergency response room is not just leading rather than coordinating and working together in order to achieve those goals and targets. The procedures formulate a memorandum of understanding among the member organization, and further discussion as we are going to work together, we'll find the best way to communicate or communication tool. And regarding financial governance, as I explained earlier about transparency, and it's going to be we use the single bank account for Sudan Doctor Union to be used as a reference for fundraising and donation, but it's going to be a committee comprising from different members, different organizations to look and monitor the fundraising, monitor how it's going to be sent and distributed. And regular auditing, transparency, and visibility of transactions for all organization members. We will sit or decide together the best way to monitor things like, for example, a spreadsheet or Excel sheet visible for all the members, organizations. As we all know, Sudan emergency rooms, on the ground in Sudan, they risk their life and liberty to assist people, and last year they've been nominated for Nobel Prize, and this year they got the European Union award for Human Rights Prize. So we need to support, work with them, and my last slide is about just summarizing everything. Share experience, disseminate results, and build the collaboration to get a better outcome. This is the link for donation and websites for the Sudan Emergency Response Fund, and there is an email for information. This is the donation link, and that's it for me.
Okay, we can see you now. Asma, you can start.
Yeah. Shall I start?
Yes.
Hello, good afternoon. Assalamu alaikum, everybody. First, thank you very much for the Sudan Emergency Response Fund, and also my thanks to London Humanitarian Emergency Room, where they work tirelessly for a long period of time, and I really appreciate that the Sudanese Doctors Union just taking over and just turned it into a fund, which is something we all needed. I am Asma Amin Abdullah. I am the CEO and founder of Empowerment for Change, and a chair and founder. Empowerment for Change is an organization registered in the UK, and I am the chair and founder of an organization registered in Sudan called Women for Sustainable Development, registered in 2020. So I'm now contributing here with, of course, different hats. The first hat, indeed, I am a Sudanese person being affected by this war, where I lost 2 of my brothers and a sister, and I lost 2 cousins, and I'm sure most of the Sudanese, they have the same situation. And also I'm here representing the 2 organizations. What I will do in this presentation, first I will talk briefly about the situation generally, the humanitarian situation, which is actually highlighted by the UNICEF. And then after that, I will talk about the 2 organizations and their role in helping the humanitarian situation in Sudan. So just a quick highlight from the UNICEF. Actually, UNICEF said, despite the extreme situation and millions of people requiring assistance, the response in Sudan remains critically underfunded, and this is really risking the lives and well-being of vulnerable children and families. They said 30.4 million people in need of humanitarian assistance, which is 23% increase from last year, and 15.6 million being displaced. Children, actually, this is the number of children being affected by displacement and malnutrition, and 3+ million children are at risk of deadly epidemics due to collapsed health systems. 24 million people face acute food insecurity, and you can see the figure. Okay, I will just skip this. Okay, so you saw the situation from the UNICEF, which shows that the humanitarian situation is acutely underfunded, And this is why we all understand, as people trying to help in Sudan, we understood why we couldn't get any support. Actually, I'm contributing through the two organizations, but actually the main source of funds we use for the two organizations are actually from my own salary and salaries and from my friends and their families and people we know. We launched an appeal through Empowerment for Change, but it didn't bring any amount of money. Maybe the amount of money it brought about 300 pounds, not more than that. So I can understand, but this is actually something from the whole world because they know the situation in Sudan, and United Nations and other international organizations declare that the situation in Sudan is the biggest humanitarian emergency situation happening in the world. So the situation is really very difficult and very critical, and this is why we need to work hard to improve and change the situation. Going to talk about Empowerment for Change, it's an organization established in 2015, and it's about inclusivity, it's about empowering women and inspiring women. I'm trying to move quickly so as to go to more. The establishment of Empowerment for Change with 4 main objectives or purposes. The main one is to promote equality, diversity, and inclusion, and to reduce poverty. And of course, you know, I'm expecting maybe some people from Sudan are seeing this. Maybe at some point I need to talk in Arabic, but I can understand there are some people who don't understand Arabic are present here in this event. So reduce poverty. There is poverty in the UK, and mainly after the period of high cost of living, and still actually going on. So we need to help people. This is why we offer free food. We have food security project to help people with free, fresh, healthy, balanced food. We give people also some food voucher to go and buy the food they wanted. And also sometimes we distribute second-hand clothing, all this. Besides offering some kind of service for people to improve their income through accessing their entitlements, their welfare benefit entitlements. So also one of the objectives is to enhance education and awareness of people about different opportunities, and also to advance environmental protection. So accordingly, we have several projects we run. One of the projects is helping people to set up their social enterprise or private businesses. We have community climate action. As part of this, we do cycling, sewing and upcycling, and we do food security. I have spoken about it. We have different projects working in heritage. And these projects actually to address several issues. One of them is lack of equality and inclusion of ethnic minority women. That means helping the people who are living in Scotland to be able to understand heritage in Scotland and understand the role of women. We have at the moment a project running called Sustainable Co-Production, where ethnic minority women are trying to engage with the heritage sector and add their voice and sometimes co-produce or change or try to adapt the narrative in the heritage sector or museums to add their voices or their views. We do inclusion, several kinds of projects, which is mainly about inclusion or engagement in different sectors. For example, Reaching Milestone is a research about inclusion and engagement of ethnic minority women in the health sector. We do a lot of projects in community well-being and mental health. We run more than 6 projects since the COVID. And then we help people also to access employment. And these are new spot projects and deserve to be inspired. So, going to Women for Sustainable Development, an organization established in Sudan and registered in Hague in September 2020, is vision about to help women through inclusivity, equality, and help them to be equal active citizens, and also improve the leadership. يعني نساعد المرأة السودانية تكون عندها صيغة مؤهلة عشان يعني تكون more sustainable، ممكن تعمل business أو ممكن تلقى jobs. وعندنا طبعا يعني you will see later some volunteering programs. والميشن بتاعنا إنه inspiring إنه نحفز الwomen إنه to get involved ونعلمهم يعني السكيلز بتاعت القيادة. So what we did after the war, of course, in the beginning, in 2020, we started with capacity building, and also we done needs assessment survey, and it went really well. But suddenly, then several political issues stopped the work of most of the organizations like us. But now we are working in humanitarian relief. So what we are doing in humanitarian relief, we started in 2023. In the beginning, we are focusing on a school feeding program, and we mainly working in northern state of Ndongula, and we work also in Omdurman. So I have two teams, one team working in the northern state, المديرية الشمالية, the other team working in Omdurman. So besides school feeding, we do community feeding programs. We go and work with the people in the refuge center or camps, and we mainly involve women in preparation of the food and volunteering. This is beside our team. So we done several events you will see later, and we also support women and girls emotionally, keep them involved in empowerment for change, train them, and just try to deliver some programs in the center. So, for example, we deliver about food hygiene, cleanliness of the camps, all these kind of things being delivered by our volunteers. So this is just a photo from our team in Omdurman while they are working to distribute the food. And this is a photo this is one of our volunteers in Dongola when they are delivering some of the food to a high school in a place called Maraga, which is like a village beside Dongola, and also they deliver talk as well. And this is just a photo of celebrating Eid al-Adha in Dongola. This is one of the camps, and you can see the women are involved in food preparation, and they are really very happy to volunteer, and they come and ask us if we can involve them in volunteering. So this is a video. Excuse me, I will. Okay, this is showing the work in the northern state of Dongola. There is another video which is about 1 minute in Omdurman. So those are two videos just show the situation and show really the dear need of the people in the whole country. And Empowerment for Change or Women for Sustainable Development is really willing to work with any organization, any group, or any establishment who can really improve the situation. It's just purely for humanitarian emergency help. Okay, the next part it's talking about the challenges faced by women, girls, mainly, and of course children and family. So we think during this war, one of the issues which made the situation very, very difficult and disastrous for women and girls are the gender blind response. We know it's war, but also I think the atrocities and all the problems faced by the women was something really unbelievable. So failing to consider distinct gender response leading to vulnerability, and also failing to understand the role of different gender in crisis situation, leading to widespread gender-based violence, and leading to ineffective and equitable humanitarian aid. So what are the key factors that have led to gender-based violence? As we said, ignoring the gender-specific needs and inadequate response to gender-based violence. People know and heard about horrible stories, and nobody really done anything about it. And inadequate response to gender-based violence. People know and of course all the decisions taken by warlords, but at the end, I think women should have a role. Most of the women's organization, I work with several organizations, maybe more than 20 organizations. I cooperated and talked to them, had meetings, one of them in Port Sudan, one in Kassala, and several in Dongola, and one in Sinja, and all of them, any one of them are struggling to do anything. Nobody really supporting them. There is no funding, but not only funding. People are not really including them in anything. So exclusion of women from decision making is a big factor leading to this. Unsafe aid delivery mechanism, also this is something really affecting women and girls, because aid is distributed in a situation where there is no security, no protection, and this can lead to so many crimes. That data gap, and this is something I know is difficult during the war situation, but I think even if people who are outside Sudan, they can collect some data, and this will help the situation.
Thank you so much, Asma. We are pressed for time. If there are any missed points, can we mention them during the discussion?
Yeah, okay.
Thank you so much.
That's fine.
Thank you so much.
Yeah. Okay. Thank you very much. I'm looking forward for the discussion.
Thank you. Our next speaker is Rania Suleiman. Rania Suleiman is a registered pharmacist in Sudan, and now she's practicing in the UK as a behavioral therapist, supporting children with autism and special needs. She's a former member of the Central Committee of Sudanese Pharmacists under the Sudanese Professional Association. Rania,
thank you.
On behalf of the Sudan Women for Peace Group.
Sudanese Women for Peace. Thank you.
Sudanese Women for Peace Group.
Thank you very much. Ladies and gentlemen, members of Sudan Emergency Response Fund, Sudan Doctors Unions, and honorable guests, thank you for this opportunity to address to you today. I stand before you deeply grateful for this platform to shine a light on a horror that's all too familiar to my community, unfortunately, which is the deliberate use of gender-based violence in Sudan's war, and the untold stories of suffering and courage, stories from Sudan where women continue to endure unimaginable hardship amidst conflicts. Sudanese women have long been the pillars of the community, contributing in every phase of society, from agriculture to education, in healthcare and entrepreneurship. They are leaders in the civil society, human rights advocacy, and grassroots movement, tirelessly championing causes that uplift the entire community. During December 2018 revolution, the world witnessed their bravery. Women stood at the forefront of the peaceful protest, demanding change and democracy. Dubbed the Kandaka, the Nubian queen, Sudanese women became global symbols of courage and resistance. Their chants, like الطلقة ما بتقتل بيقتل سكات الزول الطلقة ما بتقتل يقتل سكات الزول الطلقة ما بتقتل يقتل سكات الزول. These chants means that the bullet doesn't kill. What kills is the silence of the people. This chant echoed across the continents, inspiring movement beyond Sudan's border. These women did not only march, but organized, documented abuse, and advocated for democratic governance. They envisioned a Sudan where equality and justice prevailed. Despite their remarkable contributions, Sudanese women have been disproportionately affected by the conflict. Sexual violence has been persistent women in Sudan's war, from Darfur in 2003 to the current war, started April 2023. Women who once led the movement for change are now targeted. Their bodies used as battlegrounds by warring parties. The statistics I'm about to share with you are not just numbers. They are voices of mothers, daughters, sisters, and friends whose lives have been shattered. In 2004, Amnesty International documented 250 rape cases during a 10-day visit to a refugee camp in Chad, with many survivors enduring gang rape. In 2014, Human Rights Watch reported over a 36 hours period, at least 221 women and girls were raped by the Sudanese soldiers in Tabit in North Darfur. From April to December 2023, the United Nations documented 118 cases of conflict-related sexual violence, which majority of incidents attributed to the Rapid Support Forces. In Khartoum, between April 2023 and February 2024, healthcare providers treated 262 survivors, including girls as young as 9 years old. In Al Jazeera, 288% increase in gender-based violence was reported in 2024, reflecting a dire situation where many incidents remain hidden. UNICEF reported that over 200 children, some as young as 1-year-old babies, were raped in Sudan since beginning 2024. Guess what? I have just calculated more than 1,000 in different states of Sudan, different years, from different organizations' reports. As you may all know, the sexual violence impact is huge. Physical consequences on the survivors, injuries, sexual transmitted diseases, unwanted pregnancies, and chronic health issues, psychological effects like post-traumatic disorder, depression and anxiety, suicidal thoughts, social impacts that the survivors face isolation, economic hardship, displacement, and barriers to justice. In Sudan, these challenges are compounded by limited access to medical and psychological services, cultural stigma, and ongoing conflict that restricts humanitarian aid. Ladies and gentlemen, the numbers we have here today are not just statistics. They are lived experiences. These are not merely numbers, but they are human beings. Women whose lives and future are being torn apart. We are here today not just to listen, but we must do something. We must demand for end of this war in Sudan and immediate halt for the sexual violence by urging the international and regional bodies to pressure Sudan's warring parties, call for stronger accountability measures and robust support for survivors, advocate for International Crime Court, ICC, to extend the investigation beyond Darfur to all Sudan. As a member of Sudanese Women for Peace and Sudan Doctors for Human Rights, I promise that we will continue to amplify the voices of these women, highlight their silence, and advocate for justice and peace. I have no doubt that Sarah's story has touched every heart in this room. We cannot stand with our hands tied. Each of us has a role, from raising awareness, demanding justice, and providing support. Thank you very much, and Samponi.